Apart from this machine, which had been used to measure Adele's random blood sugar when she was rushed into the hospital by her two sons, Timmy and Sam, about 3 days ago, this machine, which is also called the glucometer, had measured Adele's random blood sugar to be quite high. Yes, if I can recall from our 2 previous live episodes, her random blood sugar had been found to be about 160 milligrams per deciliter or above that. And so, as Timmy and Sam, her two sons, walked towards the laboratory, to pick up the results of her remaining investigations, or should I say, to pick up the results of her investigations, because the other investigations that had been done bedside when she was rushed into the casualty. Both her sons were deep in thought. Timmy, her youngest son, her Gen Z son, what was he thinking? Oh, my mom, our savior, so to speak, has been diagnosed with type 2 diabetes mellitus, complicated by diabetic foot ulcer. I just hope she won't lose her leg. I just hope she won't lose her foot, her toes, as my friend, the pretty nurse, told me. I do not want to be the leader of the house. Mommy Adele does everything. In fact, me, I'm planning to japa, to leave the country for, better shores, so to speak. Mommy Adele, I hope you get better. But what was Sam thinking? Sam, her eldest son, who had also been recently diagnosed with type 2 diabetes mellitus, but had kept it a secret. He had only just revealed the secret at the emergency room when he came in with his mom, was feeling guilty. And what was he thinking? In his mind, he thought, Mommy Adele, please, I hope you get better. I do not want you to become an amputee. I don't want your toe amputated. Please, Mommy Adele, in his mind, he thought, please get better. And as he was walking, he reached out for this bottle of water and he continued to drink. Yes, his doctor had told him that diabetic patients in this sort of weather, in fact, in most the types of weather, should always drink a lot of water. It will help them, to help to rehydrate them, prevent them from dehydration, and it will help with their diabetic condition. And so, as they picked up the lab results, they now remembered that, they needed to go to radiology as well. They had picked up the blood results, they had picked up some urine results, and yes, they needed to go and pick up her chest x-ray, that was one, the results of her ECG or electrocardiogram, that's two, the results of another x-ray, yes, the most important one really, the x-ray of her left leg, showing her ankle and her foot, to outline her bones, her soft tissues. Was that leg, was that foot, was that second toe dead or not? Did Mommy Adele actually have Charcot's arthropathy or Charcot's foot disease? Who knows? We'll know later. So keep on watching. Now, they waited outside Dr. Mohammed's consulting room. Yes, Dr. Mohammed had told them to come to his consulting room so that they could discuss Mommy Adele's lab results, even before going to see Mommy Adele to counsel her concerning the results of the lab results. Why did he say this? Well, it was actually the suggestion of Sam, her eldest son. Both of them had noticed, both Timmy and Sam had noticed that Mommy Adele had been crying, sobbing, ever since she had come to the hospital. And so they knew that she was so emotional. So they needed to prepare a way, to strategize a way in which they would reveal the results of her tests to her in such a way that Mommy Adele would accept them and agreed to do whatever was necessary to save her condition, to treat her condition of diabetes mellitus type 2, as well as treat this complication of her diabetic foot ulcer. Her toe was at risk, her second toe was at risk of being lost, of being amputated. Her foot was at risk too of being amputated. And in the worst case scenario, her leg was also at risk of being amputated. But all this would be based on the clinical scenario, how Mommy Adele's general condition as well as her limb appeared bedside, as well as the results of these investigations. And so as they sat down to strategize, Mommy Adele was on the ward. Mommy Adele was sobbing unconsolably. Timi's girlfriend, in quotes, nurse, noticed she was upset from her front desk. But she had been trying to console her since morning, since she took up her shift. In fact, she was the one that gave Mommy Adele her medication this early morning. And there was just nothing she could do to console her. She had already told me anyway. Why was Mommy Adele crying unconsolably? Well, first of all, she was feeling sorry for herself. Yes, she was feeling sorry for herself because if you had watched the past live episodes of Mommy Adele's story, you'd realize that she had all the signs and symptoms. Well, not all the signs and symptoms, but she had a lot of the signs and symptoms that something was wrong with her body. She may not have known that she had diabetes mellitus, but she had some warning signs and symptoms that, yes, she had noticed, but had, brushed them aside. And can you imagine that, my son, Sam? He knew he had type 2 diabetes mellitus, and he didn't tell me. He was just trying to convince me to go to the hospital, she thought. Oh no. Oh no, my leg. She hated when they opened that left leg. The leg she had injured her. The leg that had the wound that was at risk of being lost. The leg that was threatening to make her an amputee. Mommy Adele was not finding it funny at all. She's not finding it funny at all, and at all. She was also mad at Paddy the chemist. Didn't she carry herself to Paddy the chemist? Yes. Sam had said he should take her to the hospital, but she had disagreed. She had gone to her comfort zone, to Paddy the chemist, to treat her wound, thinking that it was just a normal wound from a fall, not knowing that she was also a diabetic. And because he was not a specialist, he had done what he only just knew from years of trial and error. Trial and error. And she had gotten worse. Maybe if I had agreed to go to the hospital earlier, she thought, maybe I'd have gotten better. And this, my leg, wouldn't have been at risk of being lost now. Oh, what else was Mommy Adele thinking of? Well, Adele was thinking of the expenses, the cost of all these blood investigations and tests she had to undergo. In fact, Tam and Simi had gone to pick up the results of the tests. She knew that Sam was footing the bill of the tests, but who knows about subsequent ones? Yes, she knows these hospitals. Mommy Adele was not a spring chicken. She was experienced, so to speak, in the world. She knew that hospitals were not cheap, especially where she lived. And she knew that this was just a preamble. Even though they were going to come and discuss the results of the lab tests with her, as well as other tests that had been done, she knew that more was to come. Yes, more was to come. Maybe more tests. And then she can just imagine the amount of money for dressing this her leg, this her smelly leg. They need to compensate those nurses for dressing this my smelly leg. Because if I were the one, me, will I agree to be dressing this smelly leg? She thought, and she just laughed. Anyway, I think it's a public hospital, so maybe they might not pay them that much money for dressing this kind of my leg. Look at all those wounds now on the ward. They're trying, Sha. They're trying. They're trying by dressing those wounds. So Mommy Adele was upset by all these factors. In fact, she was even thinking of them. Her mind was going far far, far, far ahead. Her thoughts were going far, far, far ahead. She was thinking that she might need to sell her gold. Yes, I might need to sell my gold for this, my treatment. The gold that I've been saving for my beautiful, dear granddaughter, who is my namesake, Adele. The gold I've been saving to keep for her wedding or even for a rainy day. Oh, oh, God help me. God help me. And so, as she prepared to eat her breakfast after her morning medication, she thought, as the dietitian, or should I say, as the porter bought her food, the dietitian had already prepared her diabetic diet. In fact, Adele thought, I even have a diabetic menu. That's interesting. Let us see what they're giving me this morning to eat. Sumptuous meal. Yes, diabetic meals are sumptuous. They don't have to be boring. What did Mommy Adele have this morning? What did he bring for her? Well, as she opened her food, what was there? One boiled egg. That's nice. A handful of steamed veggies, steamed vegetables. Peas, she could see peas. She could see green beans. She could also see, what was that? Oh, cabbage. Steamed cabbage. Yummy. Green pepper. Colorful yellow peppers, as well as red peppers. So it looked so lovely and bright. And to accompany it, still, steamed fish, her favorite, steamed tuna fish. Very expensive, but the nutrition department tried, she thought. It's quite expensive. I know how much I buy that in the market. And what else to go with it? Something fluidy. Wow, soya bean pap. Looks delicious. And she took her spoon and she tasted it. Quite pleasant. Well, I could get used to this diabetic diet, she thought. It's not so bad after all. After finishing the meal, Mommy Adele had a short, quick nap. Yeah. I need to prepare my mind before receiving the results of these investigations, she thought. Yes, the nurse, Timmy's girlfriend, in quotes, had told her that Sam, Timmy, and Dr. Mohammed were going to come and see her to discuss the results of the investigations sometime around 2 p.m., just after her wounds were going to be dressed. I think her wounds were going to be dressed around 11 a.m., said the nurse. Let me have a nap before they come and disturb my leg, she thought. And so after the dressing of her wound on her left leg, do you know something? Her leg wound was improving. Yes, her leg wound was actually improving. And what were they dressing the wound with? Just simple materials. They had told, the nurses had given, the doctor had given instructions for them to get, pure honey. And her best friend had bought her the best, purest honey she could get in the market, because her best friend, knew the best honey in the market. She knew how to evaluate the best honey. They had bought the best honey. The hospital were using their own sterile dressing materials to dress Adele's leg. And that was all. She also needed to buy this net-like dressing material called Tulgra. Tulgra, it looked like a net. So after the nurse washed the wound with what was that drip water called normal saline, after washing the wound with the normal saline, then she would apply a layer of the honey thickly over the wounds, over the sole of her foot, also over that blackish toe, that's her second toe, that troublesome blackish toe. Then she would apply that net-like material, the Tulgra. She saw the name, Tulgra. And then they would apply some gauze around the wound. And then they would also apply crepe bandage above the level of her ankle, up to her leg. And when the nurse opened the wound today to dress it, she was surprised. She was taken aback, because when they initially came to the hospital with Sam and Timmy, that toe was looking so black. The whole length of the toe, that her second toe, was looking black. But today, some areas were looking red. And even the wound over the sole of her foot, close to that toe, and also in the center of her foot, it was looking, more red. It was looking red. It was looking pale, and it was bringing out this whitish fluid. But today it was bringing out less whitish fluid and it was looking more red. And yes, she noticed that even the foot was less swollen. And yes, even her leg was less swollen. Could it be that because she had been told to put or elevate her leg on the pillows, that maybe the leg swelling was reducing? Well, she had been told by the doctor that would help with the reduction of the leg swelling. So maybe that could be it, she thought. Yes, it was painful. The dressing was painful, but she was getting used to it. Initially, the nurses needed to give her some analgesics, some painkillers before the dressings. But now, as the pain was getting less, the wound was getting better, she noticed that she needed practically no painkillers to undergo that wound dressing. So after the wound dressings, Adele lay down on her bed, not really lay down per se. She sat up on her bed, her leg on the pillows, on the two pillows, her left leg on the two pillows, deep in thought, while she awaited the arrival of Dr. Mohammed, Timmy, and Sam. And as Sam, Timmy, and Dr. Mohammed walked into the ward by 2 p.m., yes, clockwork, she looked at them suspiciously, trying to read meanings in their eyes. She was trying to see whether they were avoiding looking at her directly, which she thought would imply that they had something to hide. But walked in calmly. She didn't know that they had a meeting prior to them coming in. They had already strategized how to break the news of her investigation results to her. So, as they walked in calmly, Dr. Mohammed first, and then Timmy behind, and then Sam third. There were 3 chairs by the side of her bed. Sorry, 2 chairs. 2 chairs. And so Dr. Mohammed motioned to Sam and to Timmy to sit down on the 2 chairs while he stood. He came close to Adele and he started to joke. Said, Adele, it seems that you like this our hospital because you're looking more cheerful, you're looking more bright this morning than I've ever seen you before. Are you sure you're not going to stay a bit longer with us so that we take very, very good care of you? God forbid, said Adele. I want to leave as soon as possible, doctor. And I hope that you don't have any bad news for me. I hope you don't want to tell me that you want to amputate my toe, you want to remove my leg, you want to remove my foot. She looked into his eyes as if to, searching for a deeper meaning into the way he was looking at her. And he smiled. Dr. Mohammed smiled. He said, Adele, we're here to discuss the results of your investigations with you. And you know me. I think you should know me by now. I'm quite straightforward, am I not? Adele looked at him. Well, yeah, sort of. So you should trust me. And your 2 babies are here. Your 2 sons are here. So trust us that we're going to break the news to you about your results calmly, truthfully, and we'll give you all the necessary advice that you need so that you will take an informed decision wherever necessary. All right, doctor. I beg, spill the beans, Joe, Adele said. Spill the beans. Well, Adele, first of all, he said, Sam and Timmy were sitting down looking at her. They were both sitting like this, looking at her, wondering how she was going to react to the news about her investigations. First of all, Adele, you know that we did a random blood sugar for you when you came, right? Yes, and I remember it was very, very high. In fact, this morning, when the nurse took my sugar this morning, although, well, it was more of a fasting blood sugar she took, it was higher, wasn't it higher? No, said Dr. Mohammed. I think it has been coming down. I've checked the charts. I checked the charts today. And it's coming down. Your sugar levels are coming down, Both your fasting and your random blood sugar levels are coming down. Although we've been using the glucometer to check for it, they're both coming down. Okay? So, I mean, that's good. But remember that I told you that we were going to do another test, which was more specific, which is more indicative, should I say. I beg, doctor, please don't tell me grammar, Joe. I want you to tell me, in plain English, in layman's language, what all that means. I don't want, you going around and round and round and round. Okay, Adele, Dr. Mohammed said. Remember I told you about one lab result that we're waiting for. It was very, very important, called the HbA1c, the glycated hemoglobin A1c result. Yes, I remember. Remember that I told you that that test is used to check and see how your blood sugar level has been faring over a particular period of time, especially over a period of years, because you may have had type 2 diabetes mellitus without even knowing it. So this HbA1c test, or the glycated hemoglobin test, HbA1c, hemoglobin A1c test, is supposed to check whether the control of your sugar has been good or not, even though, well, you have been undiagnosed all this while, isn't it? Yes, doctor. Yes, well, the value we got for this test was 8.5%. Adele said, so 8.5%, what does that mean to me? What's 8.5%? Tell me something I can understand, please. She said it not too aggressively, though. Dr. Mohammed smiled. He said, well, the result shows that, yes, you have poorly controlled type 2 diabetes mellitus. And so what does that mean? Adele said, well, that means that you're also at risk of small vessel disease, that you're also at greater risk of microvascular disease. So what's microvascular, said Adele. Timia and Sam looked at one another. Nervously, Dr. Mohammed said, well, microvascular disease means that, you're at increased risk of developing, disease of your small blood vessels, especially as in your own condition that your diabetes mellitus is complicated by this diabetic foot ulcer on your left leg, your foot. Your toe. Remember that your toe was looking blackish. But doctor, this today, as they were dressing it, it was looking better. Yes, of course, said Dr. Mohammed. Of course it will look better because we have begun treatment. But still, that's your toe, that's your leg is at risk of disease. And so what does that mean? Yes, when we say it's at risk of disease, that means, the blood flow to the leg might not be as it should be. And so what does that mean? Does that mean that I'm going to lose my leg, said Adele? Well, yes, it might mean that if your blood sugar level is poorly controlled over a long period of time, and it is such that it has been so long that that leg or limb is diseased, it may be that that leg might not be able to be saved. Oh! You mean you're going to cut off my leg, said Adele. No, we're just saying that foot might not be that toe might not be healthy, the foot might not be healthy, and who knows, maybe even the whole leg might not be healthy. But I haven't finished telling you the results of the tests yet, okay? So let's take it step by step. Okay, Adele, please calm down, all right? Sam and Timmy, please, talk to mommy. You haven't spoken to her since we came inside this ward now. Speak to her. Tam and Simi held Adele's hand from either side, from each of their sides. Sam held her hand from one side, and Timmy held her other hand from the other side. Mommy, we love you. We just want you to be calm, okay? We want you to just listen to the doctor, and he's giving us the best advice. Please just listen to him, okay? All right. So what else? Now, said Dr. Mohammed, because your glycated hemoglobin A1c result test is high, and because of the reasons I've told you about the microvascular, abnormalities that you're more at risk of, we needed to do an ankle brachial index. I know that you might not have known when they were doing that for you, but we did a test called the ankle brachial index, ABI. And the results turned out to be not too favorable to. Oh, Adele said, oh no. It turned out to be 0.6. Okay, Adele, said Dr. Mohammed. It turned out to be 0.6. And so what does that mean? Well, Dr. Mohammed said, Adele, you need to go for further investigations. Oh, more money. Sam, Timmy, Adele said, more money. I'm going to spend more money on investigations. Sam, I know you've tried. I know it's your money you've been using for these tests. But me, I don't have money. The small money I have is for my granddaughter, Adele, when she's going to get married. The little gold I have. Mommy, please calm down, said Sam. Please, let's calm down. Don't worry, all will be okay. Let's take it step by step. All right? Okay, said Adele. All right, continue. What else can I do but to listen to you? Yes, said Dr. Mohammed. So we need you to do another investigation called the Doppler ultrasound scan. Okay? You're going to do that, and it's going to outline your blood vessels for us to really know whether or not your leg is, your limb, that's your left limb, your left lower limb is healthy or not. It will outline all the blood vessels in that leg. Okay, Adele? Please, do you agree to do it? Do you agree to do it? Yes, I'll do it. I'll do it. No problem. I'll do it. But Dr. Mohammed, you're going to be the one to bring out the money for the tests. How much does it even cost, Seth? Dr. Mohammed started laughing. Adele. I like your spunk. I love it. Okay? All right. So what next? The results of your x-rays. I have some good news here, Adele. Come on, just relax, okay? What is it? What is the good news? Said Adele. Sam and Timmy started laughing. Well, the results of your leg results, your leg x-rays, your leg, your ankle, your foot x-rays. Yes, it does show some abnormalities. Yes, it does show that you have Charcot's foot disease, Charcot's arthropathy. What is Charcot's foot? Said Adele. Charcot's foot is a destructive disease of the foot. And then you're telling me that it's good news, said Adele. You're telling me that it's good news? No, just hold on, Dr. Mohammed said. It does show that, yes, your ankle joint is not too healthy, but it doesn't show that your foot bones are unhealthy, especially that your second toe. It's not really showing, it's not showing any abnormal features, although it might still be a bit too early to say, but it's not really showing some abnormal features. So we're hopeful that, that toe, that foot, that leg, that your left leg can be saved. But let us see the results on that Doppler ultrasound scan. Okay, Mama? And then we can now call the orthopedic surgeons to review. Okay? Although I've already sent for them to come and review it anyway, but I'm sure they'll want the results of the Doppler ultrasound scan while they're still also reviewing the x-rays. They're going to see you today, immediately after the results of your Doppler ultrasound scan are revealed. Mama, I know you're going to do that test today, right? I will do it, Adele said. I'll do the test. Sam, Timmy, I'm ready to do it. Yes, Adele, I love your spunk, said Dr. Mohammed. Now for that your wound. Your full blood count test results. Although, thank God, it shows that you're not anemic. I trust Adele. I know that you eat very well. Yes, Adele said, I eat very, very well. Yes, so you're not anemic, even though you've been ill, for a while, but you're not pale. Even clinically, you're not pale. And from your blood test results, you're not pale, you're not anemic, but there's evidence of infection in your blood, okay? Because your white blood cell count was high. Well, anyway, I know, of course, that is expected now. I mean, I've been sick, my leg. See, this is my smelly leg now, doctor. What do you expect? What do you expect? Yes, doctor said. Yes, so most likely, because of the infection of your toe, of your foot, some bacteria might have gotten into your bloodstream, and that is why that test is showing some signs of infection in your body. And we also took a swab, a sample of the fluid in your wound to test it, isn't it? That whitish fluid that's coming out of your wound. Yes, doctor, that's smelly fluid. Anyway, I'm even happy that it's getting less now. The smell is getting less now. Thanks to this Timmy's girlfriend. She pointed at the nurse at the front desk. Timmy, that your girlfriend? She's trying, Sha. She's trying. She's patient. Just that she talks too much. And they all looked to see whether the nurse was listening to them. So the test results show that yes, you have infection, a bad one actually. But I'm happy that your wound is getting better. Okay? So the plastic surgeon is also going to come and see you, Mama. Hey, all these doctors coming to see me. The endocrinologist, the nutritionist, The orthopedic surgeon will come and see me. The plastic surgeon will come and see me. Who else again? Well, Dr. Mohammed said, we hope that the vascular surgeon doesn't need to come and see you. Okay, because maybe that might mean that, okay, he's going to be the main one to confirm that my leg is gone up or something. Dr. Mohammed smiled and said, no, don't worry. I'm just joking. Okay? I'm just joking. All right? Your leg will, by God's grace, be saved. By God's grace, your investigation results will come out fine after this. And it's looking like, your leg will be saved. But let's keep on following instructions and having good hope, okay? Okay, said Adele. What else again? What other results are out? Well, luckily, Mama, said Dr. Mohammed, your urea, luckily, your urea, electrolyte, and creatinine results are relatively within normal limits. Well, your urea was high, but that is expected because, you came in quite ill. You were dehydrated, and so we needed to resuscitate you. So it's expected that your urea would have been high. But after receiving your IV fluids, your normal saline, you're drinking plenty of fluids now. In fact, I just saw your son, Sam, who has been newly diagnosed with type 2 diabetes mellitus, taking water now. Even in my office, you're taking a lot of water. They looked at Sam. Of course, he has to take the water now. When he was busy hiding his diagnosis from us, just telling us to go to the hospital like that. Sam just looked down sheepishly and just eyed his mother from under a bit. Anyway, so apart from that, your creatinine levels are good, showing that your kidney is good. Your electrolytes are all also within normal limits. That is good. That is good, said Dr. Mohammed. Isn't it? It's good. Your urinalysis, that is the result of your urine test. However, as expected, show that there's glucose, there's sugar in your urine, okay? But as your sugar is being controlled, it will lessen over time. All right, Mama. What else again? Yes, your electrocardiogram results that we got also were excellent. So you don't have any form of heart disease, Mama. That is excellent news because, people your age are prone to developing other health conditions, apart from, of course, the diabetes you have, the type 2 diabetes you have. So you don't have any heart diseases. From what we have seen, from your chest x-ray, from your electrocardiogram, you're good, okay? So is that nice to know? Yes, that is nice to know, said Mama. Mommy Adele. Any other thing? Well, Mommy Adele, just keep on taking care of your health, okay? And if you loved this live story, watch the past episodes here or here and hold on for the next one. I'm Dr. Hadiza Maralia Suleiman, your favorite holistic reconstructive surgeon. Join me again for another live.